I've been keeping an eye on the recent media hype around new COVID strains and rising case numbers. It seems as if this is all building up to a push for everyone to get the new boosters. I still think we could see the reintroduction of lockdowns and mandates. I don't think we're out of the woods yet. The hype hasn't died down, with sensationalist headlines such as this still making the news, hundreds of thousands in hospital as COVID-19 cases rise again in these areas. The World Health Organization says COVID-19 case numbers are on the rise in the Northern Hemisphere, with hospitalizations up in North America, Europe and Asia. When I made my previous video, I was unaware that the so-called Barbenheimer surge had been predicted by Peter Hotez. Back on July 24th, he tweeted, not to be a Debbie Downer, but anyone worried about a post-Barbie box office COVID bump, or post-op, will probably never know since no one seems to be keeping track of such things anymore. Keep up with your boosters and find a pink N95 or KN95 if you can. There are two things I'd like to say about this. First, if you have to test to know whether cases are rising, then obviously the symptoms can't be that bad. You're just looking for cases. And second, I've noticed other so-called experts recommending N95 or KN95 masks. I was afraid this would happen when studies started coming out showing that cloth masks and surgical masks were ineffective. It wouldn't prevent them from recommending or mandating masks. They would just recommend or mandate the use of N95s. If studies come out showing N95s are ineffective, they will probably recommend hazmat suits. But it's strange how Hotez's prediction predates the recent media hype by about 2 weeks, and just happened to come 2 months before the rollout of the new booster. And since then, we have seen other so-called experts have echoed his calls for mask wearing and increased surveillance. I found this article from the Daily Mail amusing. Do I need to be worried about the new COVID strain parola, and will my booster jab protect me? How do I know if I have the new variant? Question, how will I know if I have this strain or another one? Answer, you won't. It makes you wonder why you should bother testing, if the symptoms are the same as the other strains and you're not seriously ill. The Guardian continues to peddle fear with this headline, latest COVID variant spreading in UK. Health data suggests BA286, nicknamed parola, causing concern among scientists because of fear it could be more transmissible. The latest COVID-19 variant, BA286, appears to be spreading in the UK, health surveillance data suggests. The article reports on an outbreak of new BA286 variant in a Norfolk care home. It states 29 of the 33 residents at the care home who tested positive for COVID-19 have recovered, along with all members of staff. Just goes to show how much of a nothing burger this new strain is if even the majority of frail elderly people who contract it survive. From the Jerusalem Post, COVID is back, and its hosts are unwittingly letting it mutate inside them. Just as we began to believe that the shadow of the COVID-19 pandemic had lifted, the world finds itself once more in the throes of a viral resurgence. As we all know, the establishment doesn't want to let the pandemic go. The article continues, these waves of infection, including the recent surge of the BA286 variant, often originate in individuals with compromised immune systems who unwittingly serve as reservoirs for the virus, allowing it to persist and mutate within their bodies over an extended period. This protracted viral presence within them sets the stage for unwitting transmission to their family, friends, and colleagues, perpetuating the cycle of contagion. It seems the purpose of the article is to prepare the public for future pandemics. It warns that with the rise in the number of immunocompromised people globally, we could see more viruses, not just COVID, mutate into deadlier, more transmissible strains. The article ends by advising the immunocompromised to be cautious and consider wearing a mask. I don't know what good being cautious does against a virus. It's a shame that the immunocompromised are being portrayed as variant factories. I hope it doesn't lead to people becoming suspicious of them or demanding that they face special restrictions. Our next headline reads, first known Canadian case of BA286 COVID-19 variant detected in British Columbia. Notice that the comments are turned off. It's a reminder that the COVID regime never really ended. 3.5, almost 4 years after it all began, and we still can't talk openly about COVID. We still face censorship. YouTube still puts a so-called information panel under every video about COVID. The article urges the public to stay vigilant, which sounds eerily similar to the advice to stay alert given in 2020. I don't know what protection staying vigilant or staying alert offers against a virus. I think it's an attempt to make people hypervigilant. Lately, we've heard a lot of speculation about the new variants. Well, predictably, some studies have recently come out showing that the BA286 variant may not be as bad as first feared. We've seen this pattern many times. Whenever there's a new variant, experts speculate that it could be more contagious and more pathogenic than previous strains. And then it turns out, if anything, to be less pathogenic. Our next article is from Ars Technica. Concern over the highly evolved Omicron subvariant BA286 is easing as the first batch of preliminary studies on the virus suggests it may not be as immune-evasive or dangerous as its numerous mutations suggest. But they don't want us to stop worrying about COVID. The article continues, but the good news is tempered by the latest COVID-19 data, which shows increasing rates of hospitalizations, emergency department visits, and deaths, all driven by the current gang of circulating Omicron subvariants. This is another pattern we've seen play out many times. Whenever a new strain proves to be less dangerous than anticipated, the media still finds a way to keep fear levels elevated. The article has a graph showing hospital admissions, very reminiscent of the charts of doom we saw daily back in 2020. The article continues, although the COVID-19 numbers are still low relative to other waves of infection, surveillance systems and testing have plummeted to worrying levels, meaning the true burden of the disease is likely underestimated, and the current wave is hitting ahead of full booster availability, raising concern for those most vulnerable to the virus. One of the World Health Organization's biggest concerns is the low level of at-risk people who have received a dose of COVID-19 vaccine recently, the WHO Director General said in a press briefing Wednesday. Our message is not to wait to get an additional dose if it is recommended for you. They want you to think that because we're not testing as much, the numbers are probably far worse and we just don't know it. And as I've said before, if they look for more cases, they'll find them. Another common theme in these articles, as we're seeing, is the push to get boosted. Getting back to the article, 3 new studies out in the last few days, all preprints that have not been peer-reviewed, may help explain why the subvariant has stayed mostly on the sidelines. Collectively, the studies suggest BA.2.86 may not be as good at infecting human cells as the other currently circulating subvariants, yet its mutations are not enough to overcome the high levels of immunity built up from past infections and vaccinations. While the preliminary data is heartening, researchers caution that BA.2.86 can continue to evolve, and with our severely diminished COVID monitoring systems, we may have dodged a bullet. The title of this article was BA.2.86 Fears Fizzle as Other Variants Drive Up Hospitalizations, Deaths. But it seems the last thing the author wants is for our fears to fizzle out. The fear-mongering continues in our next article from New Scientist. COVID-19 linked to elevated risk of type 1 diabetes in young children. They want you worried that COVID will harm your children. But why? Let's read on. Children between the ages of 4 months and 2 years old who have had COVID-19 are more likely to have antibodies that attack insulin-producing cells, a feature of type 1 diabetes. One of the risk factors for type 1 diabetes is thought to be some viral infections, including SARS-CoV-2, the virus that causes COVID-19. A rise in diabetes cases linked to COVID-19 has been reported, but the mechanism behind it isn't known, although some have been proposed. The researchers found that the children who had SARS-CoV-2 antibodies were twice as likely to develop islet autoantibodies as those who hadn't been infected. Children who caught COVID-19 before they were 18 months old had a 5 to 10 times higher risk of developing the autoantibodies, making them the most at-risk group. We would love to see if vaccinating children from 6 months can prevent the autoimmunity that leads to type 1 diabetes, says Ziegler. We believe there's very strong possibility that preventing this early infection could very much alter whether children develop the disease. And there it is. This is a marketing campaign to get the new shots into babies. Of course, in theory, babies who'd had the shot would develop COVID antibodies, so I don't see how giving them the shot solves the problem. Here's another piece bemoaning low testing rates, this one from NBC News. All signs point to a rise in COVID. COVID hospitalizations, deaths and wastewater data, among other indicators, are all increasing as the US heads into fall. Here's a quote from the article. We're now only testing people who are symptomatic, said Guest, who added that this makes it difficult to directly compare hospitalization numbers to what was seen previously in the pandemic. Current numbers may be missing asymptomatic cases and therefore be lower than earlier ones. Asymptomatic cases sounds very 2020. Of course, an asymptomatic case is someone who's not sick. Next, let's look at this article from Euronews. COVID. Should we fear a new winter wave of infections and hospitalizations? According to an epidemiologist and researcher, over the last few months, during the summer, we have seen an increase in the transmission of COVID-19 in several European countries. In Spain, for example, we have seen a significant increase in transmission and a rise in hospitalizations linked to COVID-19. This is attributed to the emergence of new variants, which are more contagious than previous ones. The epidemiologist also added that every week, a new subvariant seems to emerge, appearing more dangerous or even more contagious than the previous ones. It's worth noting that this article came out on the 11th of September, after the preliminary studies showing that BA.2.86 may not be as dangerous as first feared had been published. There is no scientific basis for his claims. It's unapologetic fear-mongering. He continues, what we know from past experience in previous winters is that every time the cold sets in, new respiratory viruses appear, including traditional ones such as influenza and RSV in children, all of which tend to spread during the winter season. If we add to these viruses the burden of COVID-19, the healthcare system is put under severe strain. And when it's under strain, it suffers. That's what we all fear. To mitigate this risk, experts strongly advocate vaccination against COVID-19 and influenza, while stressing the importance of maintaining precautionary measures. We need to be prepared for a possible increase over the autumn and winter as diseases such as COVID-19, influenza, and other respiratory infections are likely to thrive, the Who Told Euronews. He's parroting the hackneyed line about the healthcare system being under strain. He's urging people to get their shots to protect the health system. He also mentions flu and RSV, which is a common theme in many recent news items, such as this one from the Daily Mail. CDC issues health alert as winter virus kills thousands. Doctors have been put on high alert about rising cases of a potentially severe respiratory virus in parts of the United States, which could signal a bad nationwide outbreak is to come. They're prepping us for an outbreak, and it may not just be COVID. The Centers for Disease Control and Prevention warned medical professionals the rising rates of RSV in Florida and Georgia in recent weeks signal the start of the respiratory virus season. And the Food and Drug Administration has advised healthcare workers to brace for what could be a tripledemic of RSV, flu, and COVID-19 cases this winter. They tried to scare us with the tripledemic boogieman last year as well, but it never materialized. RSV infects the lungs and the respiratory tract and typically causes cold-like symptoms, though it can be deadly to seniors who have weaker immune systems and infants whose already narrow airways fill with mucus, making it hard to breathe. RSV is the leading cause of hospitalization for infants 1 or younger in the US. Each year, the virus causes up to 80,000 hospitalizations and 300 deaths in children under age 5. And in seniors, the virus can cause up to 160,000 hospitalizations and 10,000 fatalities every year. Treatments and preventive measures for RSV have become more widely available in just the past year, and the CDC is urging clinicians to stock up on vaccines for adults and pregnant women and monoclonal antibodies for infants when they become available. We see here a lot of the same rhetoric around COVID being applied to RSV, a virus that has always been around. The establishment is determined to cling on to the pandemic regime. If COVID diminishes, other common viruses like the flu and RSV will be elevated to the level of COVID. Hyping up the severity of RSV also helps to promote the new therapeutic, which has, coincidentally, just been approved by the FDA. This summer ushered in the most substantial win for protecting babies from RSV, though, with the Food and Drug Administration's approval of a monoclonal antibody to protect against RSV called nirsevimab, which will become available in October. Nirsevimab is a single-shot monoclonal antibody that, in clinical trials, cut the chance of serious RSV infection requiring hospitalization by nearly 75%. But the vaccines for older adults are not like a traditional flu shot that is available to all who want one. Doctors must decide after consultation with their patients whether the rare, yet potentially severe health risks associated with the vaccine, such as atrial fibrillation and neurological complications, outweigh the benefit of protection. Regional increases early in the season, such as those currently occurring in the southeast, offer health officials a glimpse of what may be to come for the rest of the country in the next several months. Agency officials monitoring disease testing results in Florida found the number of diagnostic tests coming back positive for RSV exceeded 5% for about a month. The typical test positivity rate for RSV this time of year is around 3%. In Georgia, the CDC observed an uptick in the number of hospitalizations due to RSV. Around 2 for every 100,000 children in Georgia were hospitalized for RSV during the week ending on August 5th. By August 19th, that rate had risen to 7 hospitalizations per 100,000 children. Note how reminiscent this is of COVID propaganda. It looks like they're trying to scare people into demanding that the shot be made available to everyone. The uptick in cases this time of year would not otherwise be noteworthy, as seasonal RSV, along with influenza, typically begins in early fall and peaks in the winter. But the last few years have been an exception to that rule thanks to pandemic-era social distancing measures like masking and isolation. And to stave off COVID, the measures also largely stamped out seasonal virus outbreaks as we knew them. But when the world gradually reopened in 2021, after COVID-19 vaccines became available, seasonal viruses came back too. Here they are subtly trying to reinforce the narrative that lockdowns, masks, and social distancing were effective. RSV and flu are so bad now because COVID measures were so successful. They slowed the spread of all viruses. Now that we've lifted restrictions, all these viruses are coming back with a vengeance. They're reinforcing the narrative because they plan to use lockdowns and mandates again. It's important that we don't let them get away with this. RSV and flu cases may have plummeted in 2020, but COVID cases exploded despite all the restrictions that were in place. It's also possible that cases of RSV, flu, and other illnesses were falsely attributed to COVID because of faulty tests. Back to the article. Last year's RSV season was among the worst. COVID, flu, and RSV began to circulate with some overlap, garnering fears of a tripledemic. Now, there is renewed concern of another tripledemic, a situation in which three diseases join forces and overwhelm the healthcare system, which so far has not had the devastating consequences at the scale many epidemiologists feared. But that doesn't stop the media from bringing it up again. Still, the CDC is recommending doctors ramp up testing for RSV, as well as COVID and the flu, in schools, daycares, and long-term care facilities, and stockpile the latest medicine. So they want extensive testing for RSV and flu now, on top of COVID. The health agency also recommends all infants under 8 months born during RSV season should receive the antibody within their first week of life, while infants born outside the typical season should get nirsevimab before the next RSV season begins. While the shot has been shown to be extremely effective, the CDC acknowledged not all hospitals will have it in their arsenal immediately due to high demand. Pregnant women can also receive a vaccine that confers immunity to their unborn babies for a continuous 6 months of protection after birth. Naturally, the article ends with the obligatory recommendation to get the shot. This article is from ABC News. What are the latest COVID protocols amid rising cases and hospitalizations? Experts reveal guidelines around testing, treating, vaccination, and masking. I won't read the whole article, I'll only quote the highlights. I've been telling people who are medically vulnerable, older people, if they're not up to date on their vaccines now and there's a chance that they could be exposed to the virus in between now and next week, it's probably best that they get the vaccine that they can get today, Dr. Dennis Nash told ABC News. I thought the injection supposedly took up to 2 weeks to take effect. But that doesn't matter. They're trying to create a sense of urgency to drive demand for the booster. Don't wait, there's a tripledemic coming. Currently, the CDC only recommends wearing a high-quality mask or respirator if the COVID-19 hospital admission level where someone lives is in the high category and says certain high-risk groups should consider masking. Hockman said data shows masks are effective at reducing the odds of contracting COVID or spreading it to others, but she believes that people should assess their own risk tolerance when it comes to wearing masks in public. If you're in the US, the CDC expects you to monitor hospital admission levels in your area, and if admission levels are high or you're considered vulnerable, they want you to wear a mask. We're seeing a renewed push for masking. Fauci concerned people won't mask up again as COVID cases, hospitalizations, and deaths continue to rise in the US. This is from Fortune magazine. Fauci suggested that if cases surge over the coming autumn and winter months, people should consider using masks once again, particularly if health officials recommend it as a way of suppressing transmission of the virus. I'm concerned that people will not abide by masking recommendations, Fauci said. We're not talking about mandates or forcing anybody, but when you have a situation where the volume of cases in society gets to a reasonably high level, the vulnerable, the elderly, those with underlying conditions, are going to be more susceptible, if they do get infected, of getting severe disease leading to hospitalization. We know that. That's a fact. Fauci is repackaging the granny killer argument to manipulate people into wearing masks. Wear a mask to protect others. The same marketing technique was used with the shots. And make no mistake, they're trying to sell you the mask. Masks are also a visible reminder to the public that we are still in the grip of a pandemic. The article continues. Fauci stressed in Say's interview that mask mandates were not making a return, but he did remind CNN viewers that health officials still recommend masks be worn to reduce individual risk. It always makes me suspicious when authorities loudly declare that they're not planning to mandate something. I would hope that if in fact we get to the point where the volume of cases is such and organizations like the CDC recommend, the CDC doesn't mandate anything, that people wear masks. I would hope that people abide by the recommendation and take into account the risk to themselves and to their families. 2020 taught us what happens when people don't abide by a recommendation. It becomes a mandate, meaning compliance was never really voluntary to begin with. You could say that when health advice is a recommendation, it's in the pre-mandatory phase. This applies not only to COVID, but to a broad range of health issues, such as smoking. Now we come to the crux of the matter. What has the recent propaganda campaign been building up to? What are they trying to get people to do? UK MPs press for wider COVID vaccine access amid concern over new variant. From The Guardian. Government faces calls to consider extending booster program this autumn to include 50 to 64 age group. As new data appeared to show the Parola variant spreading, Rishi Sunak and Steve Barclay, the health secretary, were urged to rethink their decision to restrict vaccines to people aged 65 and over and vulnerable groups. A group of MPs wrote to the Prime Minister on Friday warning that the NHS may struggle to cope with another winter of high numbers of COVID cases, while one leading virologist said the health service was in for a rocky ride and called to a return to jabs for over 50s. They're harping on about the health system being overwhelmed again. Members of the all-party parliamentary group on coronavirus, led by Layla Moran, a Liberal Democrat MP, called on Sunak to consider extending the booster program this autumn to more groups, such as people aged 50 to 64, and to help make the COVID jab publicly available to buy privately, like the flu vaccine. Scientists have noted the high number of mutations that the new variant BA.2.86 carries, which raises the possibility that it could evade the immune system more easily or be more transmissible. The NHS is launching its autumn COVID vaccine program this Monday, with residents of elderly care homes and people who are housebound the first to get the offer of jabs. From Monday the 18th of September, over 65s and people who are clinically vulnerable, carers, and those living with people who are immunosuppressed will start to be invited for vaccines. The government brought forward the vaccine program by a month in response to the BA.2.86 variant, but did not widen the eligibility criteria, saying it would follow the advice of the Joint Committee on Vaccination and Immunization. Moran said, as the government have been flexible about moving the date, they should also consider widening the groups it should be available to. She said two of the main arguments for more boosters, such as for the over 50s, and allowing GPs to recommend people on a case-by-case basis, were reducing pressure on the NHS and helping the economy by having fewer people off sick with the virus or from long COVID. It's for the economy, of course. It especially helps boost the pharma sector. Our argument is that the government is being a bit cavalier and thinking this is just going to be fine, she said. It also does not make any sense to us that the vaccines will be available to buy in the US but not in the UK. I think a lot of people would want the option, and it's not clear at the moment why it's not available here. In other words, we should do whatever America does. Steve McCabe, a Labour MP and Vice Chair of the All-Party Parliamentary Group on Access to Medicines, also said there was a case for extending the vaccine rollout to include over 50s and a number of other groups. We should be focusing on older people, and yes, of course, on vulnerable people, but perhaps it should also include workers from groups who are likely to come into contact with the public, he said. Joan Twelves of COVID Action, a grassroots campaign group, said anyone who wanted the vaccine should be able to take it up. This is a blatant attempt to rally the public to lobby for the vaccine to be available to all. Pharma industry sources say COVID jabs will not be available privately in the UK until 2024 at the earliest. They want you to think it may be too late by then. We want the boosters now. Professor Lawrence Young, a virologist at the University of Warwick, said the government should absolutely extend the eligibility of COVID vaccines to over 50s and also consider offering them to all adults. He said the UK faced a rocky ride this winter amid growing concerns over new variants, and ministers should reverse their decision to deny boosters to under 65s. We're heading into a very uncertain time as evidenced by the recent upsurge in various variants of concern. I just don't understand for the life of me why this is any different to autumn 2022 when all over 50s were offered an extra dose, he said. Young said he understood that the JCVI had taken cost-effectiveness into account when making its recommendations. But I think amid all this uncertainty and unpredictability about COVID, it would make much more sense to give the vaccine to as wide a population as possible. They're feeding on uncertainty and unpredictability again. But it never turns out to be as bad as they predict. He added, the threat from COVID has not gone away. If anything, there's even more concern given the fact we've got waning immunity. Many folks won't have had a vaccine for a year or so. We've got new variants. I think we need to be protecting as many people as possible. Dr. Simon Williams, a public health researcher and lecturer in psychology at Swansea University, also called on ministers to reverse their decision to deny under 65s access to COVID jabs. Extending the COVID booster to over 50s would be a sensible precaution ahead of an uncertain winter, he said. In the US, President Biden is encouraging all Americans to get an updated COVID-19 booster, in addition to an updated flu jab. It is right to prioritize those over 65 and clinically vulnerable, but in the UK the decision to limit to the over 65s only seems to have been made on too narrow a definition of cost-benefit. Cost effectiveness, looked at from a broader perspective, is about more than just reducing deaths and hospitalizations. Dr. Andrew Hill, a visiting research fellow in pharmacology at Liverpool University, said excluding the 12 million people aged 50 to 64 was short-sighted. These vaccines are known to be effective against the new COVID variants. There is no other way for people aged 50 to 65 to access COVID vaccines in the UK, especially as it looks like people who want them will not, after all, be able to get them privately, he said. This is about getting as many shots in arms as possible. Let's take a look at another article. Pfizer and Moderna are pushing the new COVID booster. Should you get it? The CDC is about to decide. A small percentage of Americans got the most recent COVID-19 booster shot, and even fewer probably realize the federal government is preparing to recommend yet another shot as early as Tuesday. You'd have to be living under a rock if you hadn't heard about the new boosters. Until a week or two ago, William Schaffner read that indifference is a sign the Centers for Disease Control and Prevention should advocate vaccinating only those most at risk from the virus. But then Schaffner, an infectious disease specialist at Vanderbilt University Medical Center, changed his mind. Of course he did. Members of the CDC's Advisory Committee on Immunization Practices won him over to the argument that the vaccine be recommended for all Americans above 6 months of age, he said in an interview. The committee, which sets US vaccination policy and helps determine insurance coverage for vaccines, will vote on the question Tuesday as it weighs the benefits of updated vaccines from Pfizer and Moderna. The FDA, the CDC's sister agency, approved the 2 booster shots for use on Monday. Some of Schaffner's scientific colleagues argue the government should be recommending the shot only for frail, older, sick, and immune-compromised people. Over 95% of the US population are already COVID immunized through vaccination, infection, or both, and the risks of serious illness for healthy younger people are not great. Schaffner doesn't disagree that lots of not necessarily vulnerable Americans do want the shot for themselves and their children, and, without a CDC recommendation, insurance companies wouldn't have to pay for the vaccine. I suspect this policy would push up insurance premiums for everyone. That a partial recommendation could leave the very groups who suffered most during the pandemic, minorities and other disadvantaged groups, unable to get vaccinated if they want but can't afford to. The last thing we need are financial barriers that would enhance disparities, Schaffner said. They're playing the equity card. A 1993 law requires the federal government to pay for childhood vaccines recommended by the ACIP, and more recent legislation requires coverage of adult vaccines within 15 days of an ACIP recommendation. Pfizer and Moderna continue to make billions of dollars in sales of COVID vaccines, although they are producing fewer doses. Moderna's CEO told investors in August that the company expected its global COVID vaccine sales to be $6 billion to $8 billion this year. Depending on uptake in the US, Pfizer expects about $14 billion this year. Within a few years, both companies expect to be producing combination vaccines protecting against influenza, COVID, and possibly RSV. That's what they're really pushing for with all the RSV doomerism. About 170 million flu vaccines were distributed last flu season in the US, so a combination product could lock in a large market for COVID vaccines as well. Our next article is from Salon. COVID boosters are coming, yet many countries still can't access vaccines, causing preventable death. Vaccination is a global strategy, yet many low-income countries can't access them, perpetuating the pandemic. In an August 2021 press conference, Mike Ryan, the director of the World Health Organization's Health Emergencies Program, likened COVID-19 vaccinations to life vests one straps on in a sinking ship. He criticized high-income countries for stockpiling their third doses before parts of the rest of the world got their first. We're planning to hand out extra life jackets to people who already have life jackets while we're leaving other people to drown without a single life jacket, Politico reported him saying in a press conference. That is the reality. 2 years later, yet another booster could be rolled out in the US as early as this week. Meanwhile, 2 out of 3 people across low-income countries still have not gotten their first shot. Although more than 5.5 billion people have been vaccinated against COVID, representing a massive public health triumph, vaccines haven't been distributed equally, and many low-income countries left behind in the initial rollout still haven't caught up. Yet the very nature of a pandemic occurs on a scale that crosses international boundaries, said Dr. Joanne Liu, a professor at McGill University's School of Population and Global Health and former international president of Doctors Without Borders. Ignoring parts of the world in our response will only perpetuate the pandemic for everyone. We all know that in a pandemic, we are all in it together, Liu told Salon in a phone interview. It's not good enough that one country gets to the finish line. We all need to get to the finish line at the same time if we want to end a pandemic. They want everyone across the globe to get the shot. Meanwhile, manufacturers like Moderna were accused of selling most of their supply to rich countries for high profit, although a spokesperson said Moderna has been working to improve vaccine access globally and pointed to a deal reached with Gavi and COVAX in which they distributed 100 million doses to low-income countries. Data show that delays in COVID vaccination caused more cases and deaths in low-income countries, with one study published in June of this year estimating up to 50% of deaths could have been prevented if low-income countries were given the same access to vaccines in the initial rollout as high-income countries. Another study published last year attributed 1 million excess deaths globally to greed. See how they're framing this? It's greedy to deprive poorer countries of the shots. Inequity really characterized the COVID pandemic, and that contributed to quite a bit more death and suffering than it should have, said the director of access to medicines at Public Citizen. The Gavi COVAX initiative aims to restore equitable access to COVID-19 vaccines and has successfully distributed 2 billion doses to underserved countries. But it's struggled to get off the ground, and this year the global rollout is facing a new problem: demand. Pandemic fatigue is slowing vaccine uptake in many countries that still have high numbers of unvaccinated residents. According to the Washington Post, they don't want us to grow fatigued of the pandemic. Governments and pharma haven't grown tired of it yet. They've only just started. To shift manufacturing power to the global south, 15 low and middle income countries are working to create their own vaccines in the mRNA Vaccine Technology Transfer Hub. The recipe for Pfizer and Moderna's mRNA vaccines, which are more effective than monovalent vaccines, is patented, and that information is not shared with these new manufacturers, he said. That contributes both to vaccine shortages but also to a two-tier global vaccine access reality, where the people who are getting vaccines in the global south are generally getting vaccines that have inferior efficacy, he said. So you have both vaccine apartheid in the absolute sense of shortages, and in the sense that it was as if the world was offering poor vaccines to poor people. See the perverse way in which they've hijacked the term vaccine apartheid. Although another pandemic is the last thing people want to think about, it's a matter of when, not if, the next one will strike, Lou said. COVID illuminated global inequities that have always been present. Time will tell if we learn from our mistakes in distributing vaccines equitably in the next one. COVID-19 should be our Chernobyl moment, Lou said. Who wants to have their life put on hold for 20 plus months? Who wants to have their loved one dying alone with suited men and women around them? Nobody. So, therefore, let's try to make these changes and make sure that collectively we all prepare much better. They want us to know there's another pandemic coming, and our lives could be put on hold for 20 months again if we don't figure out a way to get the whole world injected. And this is what it has all been about. FDA approves Pfizer and Moderna COVID vaccines with new formula. The Food and Drug Administration has approved newly formulated COVID vaccines from Pfizer and Moderna. Unlike booster shots released in the past, this vaccine isn't made with components of the original COVID variants that spread in 2020. It's a monovalent vaccine that targets an Omicron subvariant instead, reports the New York Times, as advised by the FDA in June. The new vaccines specifically address the Omicron variant XBB.1.5, which became the dominant COVID strain in certain parts of the US last winter and is more closely related to EG5, which currently accounts for 21.5% of cases, according to CDC data. While the FDA approved the vaccines for people 12 years of age and older, it has authorized the shots for emergency use for children between 6 months old and 11 years of age. As a result of the update, the previous boosters from Moderna and Pfizer are no longer authorized for use in the US. The FDA notes that the updated vaccines are expected to provide good protection against COVID-19 from the currently circulating variants, adding that the composition of the shots may need an annual update going forward, similar to what we see with flu vaccines. The Centers for Disease Control and Prevention is set to discuss recommendations for the vaccine on Tuesday. If the CDC doles out its recommendations tomorrow, the vaccine could be available to the public by the end of this week. This news broke while I was making this video. The CDC has approved updated XBB strain COVID boosters for all Americans ages 6 months and older. They're expected to hit clinics later this week. All Americans ages 6 months and older are eligible to receive an updated COVID booster tailored to a newer Omicron strain, the US Centers for Disease Control and Prevention announced late Tuesday. The agency's Advisory Committee on Immunization Practices voted 13-1 on Tuesday to approve updated jabs from Moderna, Pfizer, and Novavax for the vast majority of US residents. Shortly thereafter, the Federal Health Agency announced that it had accepted the committee's recommendation and that vaccines would be available later in the week. The US Food and Drug Administration has yet to approve Novavax's updated formula, but the agency authorized such boosters from Moderna and Pfizer on Monday. The CDC anticipates having adequate booster supply and shouldn't need to prioritize certain groups, like the elderly or immune-compromised, for first doses, federal health officials said at the Tuesday committee meeting. Vaccination remains the best protection against COVID-19 related hospitalization and death, the CDC said in a late Tuesday news release announcing its decision. If you have not received a COVID-19 vaccination in the past 2 months, get an updated COVID-19 vaccine to protect yourself this fall and winter. All eligible should get the new booster when possible, Dr. Benjamin, Executive Director of the American Public Health Association, told Fortune on Tuesday. It is clear that the vaccine remains safe and effective at all ages, he said. People at high risk will especially benefit from the vaccine. In a statement provided to Fortune, the American Medical Association on Tuesday said it welcomed the committee's recommendations, contending that the updated jabs would prevent about 400,000 hospitalizations and 40,000 deaths over the next couple of years. We continue to strongly urge everyone to stay up to date on their COVID-19, influenza, and RSV vaccines to protect themselves and their loved ones from severe complications, hospitalization, and death, the organization said, adding that it expected an increase in infections this fall and winter. The new boosters are dated but should still help. Last year's updated Omicron boosters, released around Labor Day, were bivalent, tailored to both Omicron and the initial strain of COVID. This year's boosters are monovalent, meaning they're tailored to just one strain of the virus, XBB.1.5 Kraken, which dominated in the US and elsewhere late last year into early this year. The strain is now nearly extinct. XBB.1.5 was estimated to be responsible for just 3.1% of US infections 10 days ago, according to the latest variant data the CDC has made available. While the newest jabs are tailored to a dying strain of Omicron, they're still expected to protect against severe disease and death from currently circulating strains, the vast majority of which are members of the XBB viral family. So they admit the new jabs are already outdated. While there will be no official priority list for new COVID boosters, the most vulnerable, including the elderly, those with weak immune systems, and young children who haven't received a COVID vaccine, should be sure to schedule their shot as soon as possible. Dr. Roy Gulick, chief of the Division of Infectious Disease at New York Presbyterian Weill Cornell Medicine, agreed with Al Hassani, telling Fortune that those who are pregnant, as well as those with underlying disease, should prioritize this vaccine along with the seasonal flu vaccine, which can be given at the same time. Population immunity to COVID from infection, vaccination, or both wanes in roughly 3 to 6 months. If the CDC's goal is to maintain robust hybrid immunity among US residents, the agency should approve boosters for everyone and strongly encourage uptake, Ryan Gregory told Fortune on Tuesday, ahead of the agency's decision. The agency's decision to offer the vaccine to virtually all Americans was the first step Gregory was hoping for, but the vaccine alone isn't enough. Mitigation tools like masks, respirators, proper ventilation, air filtration, social distancing, and proper hand washing are still necessary, he maintains. That's because the vaccine may not stop reinfections and only prevent against severe outcomes like hospitalization and death, the Assistant Dean of Research and Associate Professor at the New York Institute of Technology campus in Jonesboro, Arkansas, and a top COVID variant tracker tells Fortune. We heard this in 2021. We all need to get the shots, but by themselves they're not enough to protect us from COVID. We still need to mask, observe social distancing, and wash our hands. It makes you wonder what the shots are good for. Moving on from the topic of new boosters, let's look at some fact-check articles that came out in the last week. This one is from the Daily Digest and it's titled, Eris, could this new COVID variant lead to the return of health restrictions? It asks, will we see the return of drastic health measures such as lockdown or mandatory masks? To which it responds, while it's too early to tell, it seems unlikely at this point. I don't want to hear that a return to restrictions is unlikely, I want to hear that it's out of the question. Unlikely tells me that authorities still view restrictions as a viable option. Then there was this one from PolitiFact, COVID-19 lockdowns returning. Here's why public health experts say that's unlikely. There's that word unlikely again. Posts warning about the return of COVID-19 lockdowns and mask mandates are trending widely on social media, including TikTok, Facebook, Instagram, and X, formerly Twitter. We've seen these claims repeated by conservative commentators and politicians, including InfoWars founder and conspiracy theorist Alex Jones, former President Donald Trump, Fox News host Laura Ingraham, and Florida Governor Ron DeSantis. The fact-checkers have to paint lockdown skeptics as right-wing nutjobs, but public health experts say it's highly unlikely the US will reinstitute the nationwide mask mandates and travel restrictions that were common early in the pandemic. That's partly because there is significantly more widespread immunity today than there was after the virus first emerged. Several public health and health policy experts told PolitiFact that it's highly unlikely any level of government, local, state, or federal, will reinstate broad mask mandates or stay-at-home orders in response to COVID-19. We're just in a very, very different place now. Those measures were put into place several years ago, before we had a vaccine, before we had any kind of treatments for COVID, said the chief medical officer for the Association of State and Territorial Health Officials. Immunity to the virus, either through vaccination or prior infection, is drastically higher now than it was at the pandemic's onset. About 81% of all Americans have received at least one dose of the COVID-19 vaccine, the Centers for Disease Control and Prevention reported in May. And the Food and Drug Administration approved Paxlovid as a treatment for COVID-19. The establishment narrative is that things were different back in 2020. Of course, this implies that if things were different in the near future, then they could bring back lockdowns. It also overlooks the fact that things were not different in 2020, which is why lockdowns could return at any moment. In 2020, natural immunity was superior. In 2020, a healthy diet and regular exercise could help protect you. In 2020, vitamin D could help prevent you from getting sick. In 2020, COVID had a fatality rate close to zero. In 2020, lockdowns and mask mandates were unjustified. I fear that many lockdown skeptics also think we're in a different place now and that we could never go back. But sadly, I don't think that is true. In 2020, people were the same as they are today, easily misled. Getting back to the article, returning to early pandemic mandates also wouldn't be effective given today's political climate, experts said. It would be counterproductive from a public health standpoint to recommend or mandate restrictions to daily life that many people would not follow, said William Schaffner, infectious diseases professor at Vanderbilt University Medical Center. I think if mandates were reintroduced, most people would follow them. People haven't changed. Schaffner said he hasn't seen any sign that public health experts are considering anything that extreme. I don't know of anyone who's even thinking of lockdowns, let alone mentioning them. Funnily enough, Professor Schaffner himself is mentioning lockdowns and has apparently given the subject some thought in order to comment for this article. Articles like this serve two purposes. First, they help forestall opposition by assuaging people's fears. Second, they help seed an idea in the public's mind. Even announcing that you're not going to impose lockdowns gets people thinking about and talking about lockdowns. Returning to the article, legal challenges and legislation also have weakened the government's ability to impose restrictions in response to public health emergencies, experts said. For example, the Supreme Court in January 2022 struck down a Biden administration COVID-19 vaccination and testing mandate for large employers. Legislation can be repealed. Legal challenges can be stymied. Legal decisions reversed. There may also be lawfare from the pro-lockdown, pro-mandate side. This situation creates uncertainty about the government's legal authority to impose some of the kinds of orders that were imposed in 2020 and 2021, said Wendy Parnett, faculty director of the Center for Health Policy and Law at Northeastern University. That's all well and good until the government decides that an emergency is so dire that they have to override the courts and suspend the Constitution or Bill of Rights. Jennifer Pyatt, co-director of the Center for Public Health Law and Policy at Arizona State University, said government officials are likely to be reticent to exercise their powers out of fear of political backlash or litigation. Government officials will not be reticent to exercise their powers. They will censor opposition, beat protesters, put dissidents in prison, freeze their bank accounts, seize their assets. The Association of State and Territorial Health Officials thinks the proper way forward now is that we're not going to do government mandates, but institutions may choose to make some of those decisions, and that's going to be on a case-by-case basis. What is to stop the government from advising or pressuring institutions to impose restrictions? The CDC, which is currently recommending face masks in some circumstances, is a government agency. Continuing with the article, some of these social media posts blame President Joe Biden or the federal government for the supposed impending return of COVID-19 lockdowns, but this is misleading on two fronts. In the context of an epidemic, the dictionary definition of a lockdown is a temporary condition imposed by governmental authorities, in which most people are required to refrain from or limit activities outside the home involving public contact, such as dining out or attending large gatherings. It's worth noting that before 2020, there was no dictionary definition of a pandemic lockdown. I disagree that lockdown is a temporary condition. It is at least semi-permanent. We went from 2 weeks to flatten the curve to 2 years to flatten the curve. The dictionary definition also makes no mention of business closures, church closures, or bans on protests. It's a definition that makes it very easy to downplay lockdowns. Back to the article. The word lockdown has been used more liberally to refer to any pandemic restriction. But Parnett said it's important to distinguish between lockdowns and mandates. They're not the same thing. In fact, we've never really had lockdowns in this country, at least if you compare what happened in China, for example, at the far end of the spectrum, Parnett said. It's very misleading and frankly, it frightens a lot of people to talk about lockdowns. This is a major red flag. A fact-checking article addressing whether lockdowns will return has turned to blatant denial that the US ever had lockdowns. I suppose they can't bring back lockdowns if they never had them in the first place. The article goes on. What's more, the stay-at-home orders, restrictions on in-person gatherings, mask mandates and business closures were implemented primarily by states and cities, not the federal government. We see the different levels of government playing political handball in Australia as well. You're not going to see the federal government try to do that because that's just not something that they do. That's not in their sphere of power, Pyatt said. Earlier in the pandemic, the federal government imposed temporary limits on international travel and required masks on airplanes, trains, and buses. The White House also issued COVID-19 guidance to states. If the White House issued guidance to the states, then it did have some influence on COVID policy. Moving on to another fact-check article, this one from USA Today. No, CDC didn't say new COVID-19 variant is more contagious among vaccinated. The claim, CDC says a new COVID-19 variant is more contagious among vaccinated people than unvaccinated. An August 29th Instagram post shows an illustration of a virus next to a photo of a man receiving a shot. Hashtag report, CDC says new COVID variant is more contagious among vaccinated people than those unvaccinated, reads text included in the post. The post received more than 300 likes in a day. Another version of the claim shared on Instagram received over 3,000 likes in 3 days. Our rating, false. The Centers for Disease Control and Prevention has not made such an announcement. The post distorts a line in CDC guidance that says the new variant may be more capable than past strains of infecting people who have prior immunity, either from an infection or vaccination. CDC compares variants, not vaccination status. The CDC announced in August that it was tracking a new COVID-19 variant, BA286, which has since been nicknamed Parola. It published a risk assessment on the new variant on August 23rd. The Instagram post appears to be misinterpreting a line from that risk assessment, which states BA286 may be more capable of causing infection in people who have previously had COVID-19 or who have received COVID-19 vaccines. There also is no credible evidence that vaccinated people are more vulnerable to any type of COVID-19 infection than unvaccinated people. To the contrary, the CDC reported in February that people vaccinated against COVID-19 were 14 times less likely to die from an infection than the unvaccinated. The CDC has consistently said the vaccines help protect against severe disease, hospitalization, and death in adults, children, and teens. This article puts forward a straw man argument. No, the CDC didn't say the new variant is more contagious among the vaccinated. Yes, an Instagram user may have misinterpreted something on the CDC website, but that doesn't address whether the vaccinated are more susceptible to COVID infection than those with natural immunity. And contrary to the article, there is credible evidence to support this claim. A 2022 study found that vaccinated people who had never been infected with COVID had 13 times the risk of breakthrough infection than unvaccinated people with natural immunity. Now on to our final fact-check article, also from USA Today. COVID-19 is real and new variant of the virus is spreading. The claim, there is no new variant because COVID-19 does not exist. A September 2nd Instagram post shows a screenshot of a post on X, formerly Twitter, which makes a claim about COVID-19 and the virus that causes it. There is no new variant of COVID, reads part of the post. COVID is not spreading again. COVID never was spreading. COVID is an amalgamation of symptoms caused by SARS-CoV-2. It concludes by stating there is no scientific evidence that SARS-CoV-2 causes any sort of disease, and there is no scientific evidence that SARS-CoV-2 exists. COVID was not, is not, and never will be real. Our rating, false. Multiple researchers have isolated the virus that causes COVID-19, and its genome has been sequenced. Detailed images of the virus have been publicly available for years. There have been hundreds of millions of confirmed cases reported worldwide. It's funny how it's so important to the establishment that I must affirm a belief in the existence of the virus. You wouldn't think they'd have to sell it so hard if it were true. They want us to believe that researchers have isolated the virus and sequenced its genome, but that's something we have to take on faith. They claim there are images of the virus, but images can be faked. They appeal to the hundreds of millions of reported cases confirmed by faulty tests. I'm not sure whether the virus exists, but it would be foolish to trust the people who have consistently lied to us for over 3 years. Next, I'd like to look at some articles showing the continuation of the COVID regime and the possible direction it's headed in. First up, from The Guardian. Number 10 had head insane mentality at start of COVID crisis, says ex-minister. He said, Number 10 didn't want to prioritize the pandemic in early 2020, even though the evidence was mounting. There was a post-election, ostrich, head in the sand mentality, which I saw again around the invasion of Ukraine. Its priority, and what we were told many times, was Brexit and levelling up. We have to deliver Brexit, so could your pandemic quietly go and mind your own business, please, we were told. So we had several weeks of this brushing off, and then they switched into it eventually. After that we got a lot of erratic dipping in. In Yiddish, it's called kibitzing, erratic and ill-informed interference. I won't spend too much time on this article. I'll just point out that the establishment is locking in the narrative. COVID was a crisis. The government should have acted sooner. It should have been prepared for a pandemic. How dare people be distracted by other political issues? To our next article, and perhaps yo-yo flu will be the next big thing we can add to the growing list of boogeymen, along with RSV, flu, and long COVID. From the Sydney Morning Herald. We've been constantly sick, why we can't kick the yo-yo flu. Australia is grappling with the yo-yo flu, where cold symptoms continually return, as a sharp rise in respiratory infections has been driven by an early flu season, continuing cases of COVID-19 and the circulation of nasty viruses. Caroline Diamantes, the owner of Balmain Community Pharmacy in Sydney's inner west, said about 10 customers a day were coming into the pharmacy requesting leave certificates and cold and flu medication, many of them coming back every few weeks. The newly emerging term yo-yo flu refers to people getting sick consecutively week after week, maybe feeling like they're getting better and then getting sick again, but it is certainly not a new thing. Our next news item. 3 lessons from COVID that could help global leaders prevent the next pandemic. Everyone has things that, looking back, they would have done differently in the early days of 2020, had they known how the COVID-19 pandemic would tear across the globe. But those regrets may be particularly poignant for global leaders whose actions, or lack thereof, had direct impacts on how COVID-19 spread. Joanne Liu, a professor at McGill University's School of Population and Global Health and former international president of Doctors Without Borders, has some advice for those leaders. If we wanted to, this could be the last pandemic. It's a political choice, said Liu, who was part of the independent panel for pandemic preparedness and response, established by the World Health Organization to author a report examining lessons from the response to COVID-19. It's a political choice, Liu says, that sounds rather ominous. Fast, immediate steps are necessary. Looking back at the beginning of the pandemic, Liu said that the first mistake was inaction. For most of the world, it was a lost month, the month of February 2020. People sat on their hands and nothing much happened, she said. So Liu is calling for political action to prevent the next pandemic, and it needs to be swift. What would this mean for lockdown dissidents? We might not get much warning next time. We would only have a narrow window to prepare ourselves for and respond to harsh restrictions. The article continues. Global solutions need to be prioritized. One of the key recommendations that Liu and the independent panel made on pandemic preparedness was that leaders need to come together holistically rather than letting each country fend for itself. We need to have a sustained high level of attention from world leaders, Liu said. This should be the Chernobyl moment, the moment that we come together and we just say, this is it, guys. We align. We see a global governance and we stick to it. So she's pushing global governance under the guise of pandemic management. If they succeed in this, there might be nowhere else to go next time, nowhere to escape to. Every country needs access to countermeasures like vaccines, she said, which will also require robust funding. Governments need to come together and potentially spend billions to save trillions of dollars. She's already talking about billions of dollars for vaccines before the next pandemic has already started. She compared pandemic preparedness to the climate crisis. I cannot in Canada just say, oh, I'm going to do my little bit and it's going to be enough. She's tying this in with the so-called climate crisis, another global crisis that we hear requires global governance. This type of global unity didn't happen during the Ebola outbreak of 2014 to 2016, Liu said, and it's what worries her the most about the next potential pandemic. It is normal to some extent that each country would be for its domestic interest. But at the end of the day, we are so interconnected, interdependent, that we need to come together, Liu said. It sounds like there's no room for dissent in Liu's global pandemic regime. Let's take a look at another article. This is from the Globe and Mail. How did the pandemic go from apocalypse to afterthought in Canada? Just reading the last few paragraphs. The protection provided by the mRNA vaccines that were so critical to slowing the pandemic is known to wane after 6 months. While this is less of a concern for healthy younger people, it's a big deal for older ones and those who are pregnant or immunocompromised. And yet they aren't keeping up to date on their vaccines. The cumulative proportion of people in Canada who received a second shot or a booster in the past 6 months was 5.7% as of June 18th, barely 1 in 17 people. The numbers are especially troubling for older, more vulnerable people, just 11.1% for those in their 60s, 18.3% for those in their 70s, and 21.9% for those over 80. So this article is trying to create panic over low uptake rates. Now that the new boosters have been approved, I suspect we will see a big push for everyone to get boosted, possibly with the reintroduction of coercive measures. People need boosters, the article continues, but they aren't getting them. This is in spite of the fact that the National Advisory Committee on Immunization said in the fall of 2022, the spring of 2023, and now again this fall, that those who are most vulnerable should get a booster after 6 months. This is especially true of anyone in that category who has been vaccinated but has never been infected by COVID-19 and doesn't benefit from what is called hybrid immunity. So where is the urgency from government officials? Why is there no alarm being raised about booster rates? Why is it that people who once imposed onerous but necessary and defensible restrictions on Canadians' lives are now failing to provide equally muscular messaging on this next phase of the pandemic? Here we have the editorial board of this establishment media outlet trying to raise alarm among the public and begging the government for strong guidance on the booster shots. Canadians should not have to seek out news articles and access government websites to figure out whether they or their loved ones should get a COVID-19 booster. They absolutely should, by the way. There should be clear and consistent messaging from Ottawa and the provinces about where we are now, what needs to be done, and where we're headed. So they're begging for more propaganda. Absent that, the message Canadians are receiving is that what is still officially a pandemic is somehow over in their country, and that COVID-19 is now a disease like any other that we manage on our own, such as the flu or the common cold. If that's the opinion of our public officials, then all they have to do is let us know so we can get on with our lives. I think this is more of a message to their readers that they can't get on with their lives until the government tells them they can. And now for our final article. State making masks and COVID tests available for schools. September 10th, Albany, New York. Governor Kathy Hochul recently announced New York State is making COVID-19 rapid test kits and masks available to school districts and boards of cooperative educational services by request. The announcement came as students began school, amid reports of the new BA.2.86 variant and a rise in COVID-19 cases and hospitalizations this summer. Hochul is also advising schools to follow CDC guidance to help protect students in the classroom. Thanks to the hard work of New York schools, teachers, and parents, we have come a long way to ensure students can safely return to the classroom. Hochul said in a news release, "Frequent testing for COVID-19 is an important part of keeping our kids safe and preventing an outbreak, and I will continue working to ensure our school districts have the resources they need to provide a safe, in-person learning environment for our students. The state will conduct outreach surveys to the State Education Department and boards of cooperative educational services this week to determine the need for test kits and masks. New York State will deliver the requested tests and N95 and KN95 masks to each BOCES for distribution to school districts. So in New York State, they are making masks and tests available in schools. If they are available, they will be used. They will probably effectively become required. I wonder if this is part of the drive to get children boosted. The theatre of testing and wearing masks might get some students or their parents worried about COVID. A notice at the bottom of the article caught my attention. Schools that experience outbreaks should work with their local health department for timely outbreak response support. That seems a little overboard for a sniffle. Thank you for watching. If you enjoyed this video, please like, subscribe, and share.